my story kind of starts over this past weekend where I visited New York City with a couple friends. I had close social contact with numerous people in the city, as well as one of my close friends whose coworker's partner tested positive. And that was something I had figured out later. And so when I had returned on Monday, March 9th, to Brigham and Women's Hospital, I worked in clinic. I felt well. I didn't have any active symptoms at that time. And then Tuesday, March 10th, I suddenly developed a runny nose, congestion, sore throat, which essentially since then has progressed into a significant dry cough, as well as a max temperature of 101.6, and overall feeling malaise, as well as muscle soreness or myalgias and chills. And so in talking to my occupational health department at Brigham and Women's Hospital, they, together with the Department of Public Health of Massachusetts, had come up with these guidelines that were fairly strict as far as who should be tested. And they were so strict because there's such a limit on the number of tests. And so I kind of fell in this weird loophole where I actually did not qualify initially to be tested. So some of the criteria were a direct contact with, or a first degree contact with someone who is COVID-19 positive confirmed, travel to one of the countries where it's pretty rampant, such as Iran, Italy, China, etc., or if I had been at work with active symptoms. And so since I hadn't really had symptoms on, since I did not have symptoms on Monday when I saw patients, but I developed them Tuesday when I was home off for the day, they said I did not fit that criteria as a healthcare provider who had viral symptoms at the time of working with patients. And so I received a phone call today, basically describing that some of these friends who I'd been in close contact with have developed symptoms. No one's tested positive yet. My symptoms are getting worse. My fever, my fever is getting worse as well. And so essentially they had said that, there are cases where you can spread COVID-19 without symptoms. And so since I had seen patients on Monday, March 9th in the afternoon, there is potential that I could have exposed some patients to that. And so testing me would be important to get that information. I think that our Department of Occupational Health Services, as well as me and other physicians, feel that it's obviously very silly to not have the ability to test a lot of people. And you look at other countries like Korea, where that's very prevalent and their tests are abundant. And so I think that as more tests become available, the criteria will certainly loosen. But it was an interesting challenge to face as a provider as far as getting tested. So I'm actually going to later today to get tested for COVID-19. Essentially, I have to go in my car alone, wearing a mask, and I will show government-issued ID, which will be presented at the front window, and then team members who are fully gowned in precaution gear will enter the car and swab me. And let's hope it's not COVID-19, but if it is, we'll kind of go from there. Had a mask on as recommended if I had any at home, and I was greeted by a nurse who was the only one in direct contact with me. She had essentially improper contact precautions with the N95 respiratory mask, the same mask we use to prevent against tuberculosis. And I was then instructed to roll down the window. I was given a nasopharyngeal swab. It was a very thin swab, the same one that we use in the hospital to evaluate for the flu. And this swab essentially goes into your nasal cavity and will reach actually the back of your pharynx, why it's called the nasopharyngeal swab. And she had to do that twice, one in each nostril. One was for COVID-19, and the other swab was for our standard respiratory viral panel. And then she performed a oral swab, which went to the back of my throat, all these swabs are very uncomfortable. Now I know what patients mean when they tell me that they do not want a flu swab done. It's very, very uncomfortable, but obviously it needs to be done. And then I was given a discharge sheet of information with some general information about how to quarantine myself, and I will be receiving a phone call from the Department of Public Health of Massachusetts to be given my results of the tests. um, and yeah, that was the entire process.